So for me, I got COVID in March 2020 at the beginning of the pandemic. I think it was just after lockdown, and we were still working, we were still seeing patients face to face all the time. And I went off sick. I just got really tired one day and thought I had flu. I got I think from the time I walked from my car to have my dinner, I couldn't sit up at the dinner table. I went downhill that quickly and became quite unwell for a very, very long time. I couldn't breathe. I stayed at home. I didn't go to hospital. My oxygen levels would fall. I was lying on my side and my front because I couldn't breathe properly. And I was like this for a while, and then kind of improved a little bit to the point where I started to go back to work. Well, I went back to work for about 2 days and didn't last very long. And then I just crashed again after that. I had a lot of fatigue. I couldn't catch my breath. My heart would race all the time. And I was like this on and off for about 8, 9, 10 months. I was off work for a year. So that took me out for a year. I was very fortunate that I had a job that was secure. And I still had my job when I went back, but I know that a lot of people with long COVID have lost their job. They've lost their livelihood. 2 years later, and it will be 2 years in March since I got COVID, I'm still struggling. So I still suffer with fatigue. So I have to pace every day. I work 3 days a week. So I work Monday, Wednesday, Friday, and have a day off in between. And then I have the weekend to recover. I feel like I'm about 100. I honestly go to work. I'm so tired when I get home. I do my admin the next day, which is my day off, and I'm still working. I feel like I'm constantly trying to catch up. Some days are better than others. So some days I have a lot of it, well, not a lot of energy, I have more energy. So I know that I can get through the day. Some days I wake up and it's not great. And I really have to think about what I'm doing, whether I go back upstairs to get something that I've left in the morning. It's planning your day down to that kind of detail that you're dealing with. So I still have really low oxygen levels a lot of the time, and chest pain and lots of issues, and I can only work part-time. And again, I'm so fortunate I have a job where I can afford to do that, because I know a lot of people can't, and they're struggling like this, but they're having to work more and just feeling rubbish, or they've lost their jobs. So I think for me, it's made a really, really big difference. You know, I can keep going, and I'm a person who is always busy, but so, you know, if I keep going and people think it's just laziness or something, or you're just not trying hard enough, but I'm a person that just doesn't stop. So I keep going, and then I hit a wall and I physically will just crash. So there's no pushing through it, or, you know, nothing like that. It just doesn't work in this situation. So I think, you know, yeah, it's just made a big difference in my life, and it's making a big difference to lots of people. I also have brain fog. So once I'm tired, I can't function. I can barely type a sentence. So again, if I get to that point, then I can't work properly. So that, you know, it's just had a really, really huge effect on my life. And I really have to carefully plan to be able to function and do what I used to do. But I think, you know, we have lots of people out there who have possibly had COVID from the beginning, sort of March 2020, who weren't tested because it was only healthcare workers that were tested at the time. So I know that, you know, I had it because I had an antibody test. My PCRs were all negative, but my antibody test was positive. So we've got lots of people in the community who are struggling with long COVID, but don't know that they have long COVID. They just haven't been right. They've just been really tired. They've never been the same. They're struggling with things. They're getting the brain fog, the fatigue, and, you know, they don't have a label for it. So if, you know, if anyone recognizes themselves in my description, or if they recognize someone else that they know, then, you know, get them to contact their GP, because there's a lot of help available at the moment for people struggling with these symptoms.